Ah, look at that. Are we in the screen? We're in the screen. Hey, stay with us for just 1 second. It's Troy right here. Again, no Hannah, just Troy. And Kyle, our special guest, Kyle, who you guys now know. I'm not even in the screen, Kyle. You get all the attention. He gets all of the
He's the man, though. He's the man.
So here's the thing. Kyle's here with us. You know he's a physician's assistant. He's going to talk about some different things today that will clear things up for you. Let's say that. It's going to clear things up a little bit, make things a little bit easier in life. But as always, would you like, subscribe, and share with all your friends? We hope you will. And wait till the very end of this short video, and I'm going to talk to you about the prizes we're going to be giving away to new subscribers. And I'd like to include the existing subscribers too. I don't think it's fair to rule them out. They've been they've been sticking it out with us, staying here for a long time. Why don't they get to win?
He's the man.
I don't like telling. So here you go. I'm going to turn it over to Kyle. He'll do the whole show, and then I'll be back a little bit later with the prizes.
Hey, once again, wanted to thank Troy for having me in. Today, thought I'm going to put a scrub top on, talk a little bit about medical nomenclature. Been a physician assistant 20 plus years. So hanging out with Troy, I'm going to have to say that I am now your favorite PA, physician assistant, personal trainer, amputee. Nomenclature, let's start with PA, physician assistant. Trying to get away from that, more to a physician associate. A lot of us will have the C on the end. All that means is we're certified, we took a big exam, we passed it. We are also considered mid-level providers. I hate to put it this way because I don't want to demean or degrade anybody because we're the big team, but we're basically between the nurses and the doctors. Alongside of us are NPs or nurse practitioners. There again, don't want to demean them or degrade them, but just about any place a PA can work, a nurse practitioner can work, and vice versa. A few years ago, nurse practitioners added a doctoral degree so they can get a PhD in nurse practitioner. Just like anybody in any, even a nurse can go get a doctoral degree. But the nurse practitioners, once they have that doctoral degree, they are a doctor of nurse practitioner, and they will often introduce themselves as Dr. So-and-so. I've had quite a few patients that get a little confused. Nothing against those NPs that went to become a doctor. Just know that they're not an MD or a DO. They do have a PhD, and you should address them as doctor if that's the way they introduce themselves. Nurse practitioners, PAs. Each state has different rules governing PAs and nurse practitioners, what we can prescribe, what we can do. Here in Michigan, PAs, by the state constitution, we have to have a supervising physician, whereas the nurse practitioners have a contract, they have a collaborating physician. So a lot of times you'll see nurse practitioners kind of off on their own and call it, they get to hang their own shingle. Quite often you'll go into a CVS or some places and we call it a doc in a box, where you have a little urgent care or medical facility there. Quite often be run by nurse practitioners because of the agreement that they have with the docs. Now in the docs, you got MDs, medical doctor, undergrad school, 4-year medical school, then they go off and do the residency. That's where they specialize. That could be anywhere from 3-4 years to 6 or 8. Alongside of the MDs are DOs. That's a doctor of osteopath. They're still docs. They still do medical school. They just have different training. I've done a lot of training under DOs, worked with DOs. They tend to be a little more hands-on because part of their training is osteopathic manipulation. Something even Troy knows. He's worked with some DOs in the past, which goes along with his massage therapy knowledge. Osteopathic manipulation is basically a realignment, very similar to what a chiropractor does. Our other doctors, a DC, a doctor of chiropractic. I was taught by a DO a long time ago the difference between chiropractor and osteopath. Chiropractors are more shotgun approach. They'll work on everything, whereas an osteopath will try to target in on the one area that needs to be worked on. I will never say anything bad about a chiropractor because I've gone through chiropractor adjustments, works great. I've also done osteopathic manipulation as well as received it. A lot of it is personal preference. I like them both. I just happen to have been trained as a DO, so I prefer that a little more. Plus, the DO being a medical provider, we can order different imaging such as MRIs, CTs, and we can also write prescriptions if needed. Now, save the best for last, because these are my favorite people of all time, the nurses. You got your RNs, registered nurse, top of the line, LPNs, licensed practical nurse, a little less training. Most RNs are going to have a 4-year degree. They also can go on and get a master's or a doctoral degree. And then the one that I've worked a lot with, VMAs, medical assistants. In my book, not to demean or degrade any of them, they're all nurses. There is absolutely no way I could do my job as a physician assistant without the nurses, whether they're RNs, and I worked with some amazing ones when I worked at the prison, MAs, who I've worked with a lot in my current career doing the in-home care. LPNs not so much, but they also worked at the prison. Utmost respect to all the nurses, what they do. I learned very early in my career that a nurse can make a doctor or a PA look like an idiot or a genius. I much prefer to look like a genius. So I'm always going to give credit to the hardworking folks, the nurses, whether they're RNs, LPNs, MAs. They truly are the lifesavers of medicine. The docs, they get the credit. They saved my life. But it was the nurses that were there with me 24/7. And I'll always give credit to the nurses for my career. Once again, as Troy mentioned, there's some big tips coming in from him. Leave your comments, leave your questions, leave your concerns, leave your complaints. Topics, great. We can always use some more. Troy's got a bunch. I've got a few. But definitely hit that like button. Share it with your friends. Share it with the medical community friends. If you're a nurse, if you're a provider, let me know what you think. But definitely hit that subscribe button. That's the big bonus. Back to the man.
Had I known that we were talking osteopathic manipulations and chiropractic adjustments, I would have brought in our spine guy and let you show us a few things. Maybe later. All right, here we are. So go ahead. You got something
I was just going to say I'd have to lay it on a table, but although we could do
That's
the lift,
right.
there are different ways you can do it.
Traction them out.
Little snap,
Anyway,
crackle, pop.
here's the thing. Enough with that, Troy. Quit talking. So make sure you subscribe. If you haven't subscribed, I can't even speak. Make sure you do whatever you're supposed to do. Click, like, boom, boom, share, whatever. But the cool thing is infrared sauna. We're literally giving away an infrared sauna to, I'd like to say everyone, but there's only going to be one. Only one winner for that one. But we'll have some other prizes below. So new subscribers and existing subscribers will all be put into the mix. All will be chosen. So awesome. Make sure that you like, subscribe, share, and please comment. Let us know what it is we can talk about, and more than just me being in the whole screen. What we can talk about to entertain you and make sure that you're getting the type of information that you're looking for. Because every Monday we're going to have, not every Monday, but most Mondays. I don't want to promise anything that doesn't exist. But most Mondays, Kyle will have a tip for you of some form, covering some specific medical condition, and will help you along the way. So, see ya. Have fun.